Good afternoon. Today I am with Dr. Dheeraj Singhal. He heads the Department of Internal Medicine at Naveen Hospital, Greater Noida. Physician or the internal medicine specialist is one doctor that every hospital wants to have, one of the best. But the irony is that there are very few internal medicine specialists in our country. Fortunately for Naveen Hospital, they have on board Dr. Dheeraj Singhal, who is very experienced doctor who has been associated with the Naveen Hospital since 2005. Welcome, Dr. Singhal. So you have been associated with Naveen Hospital in 2005. Naveen Hospital has gone tremendously, has increased their potential from 2005 to 2013. So how has the scenario changed from 2005 to 2013 in Greater Noida specifically?
Actually, when I came to Greater Noida and I joined Naveen Hospital in 2005, I think the population of Greater Noida was almost 20,000 to something like 50,000. Now, in last I think 8 years, the population has crossed almost. I think it has gone up to I think 10 to 12 lakhs. So it has gone tremendously high. And same wise, I think the medical facilities, they have flourished, they have increased. We have been providing facilities round the clock, all the emergency facilities or the medical facilities, so they have gone up in last 8 years.
India is becoming a diabetic capital of the world. Now there are different approach of managing diabetes. Even people are talking about metabolic surgeries for type 2 diabetes and all. So what is the line of treatment that you think is right for a diabetic patient who is type 1 maybe who has just been diagnosed with a raised level of sugar?
Very truly said. India is a diabetic capital of world. Basically, more than 60 million of diabetic patients are right now in India. So, we can blame it to our genes. Basically, Asian race, we have metabolic syndrome. Second thing, I think the lifestyle, it has changed tremendously in last maybe 20-30 years. Eating pattern, that has changed a lot. So I think combinedly all this effect has caused a surge in the diabetes in India recently. Not even in India, I would say the southern Asia. So the treatment also depends on the same things. First thing is lifestyle modification, that is we need to take care of our eating habits. First thing. Second thing is exercise, sedentary lifestyle, that needs to be changed. And fourth thing, the stress level. I think these are the main parameters. Then comes the role of medicine.
It's in our genes that Indians are prone to diabetes. So do you want to say that since Indians are having a sweet tooth, so is this a myth or a fact that sugar causes diabetes? Because most of the people, if you talk about, they will say ki, I used to eat a lot of sweets in my childhood, that's the reason I am having diabetes. Is this right or is it just a myth?
No, it is not truth, because the sugar doesn't cause diabetes, but a person who is prone for diabetes, if he takes more of simple carbohydrates, he will develop it sooner than the other person who is not taking sugars directly. So one who is not prone for diabetes, he can take any amount of sugar and he is not going to develop diabetes. But on the contrary, one person who is prone for diabetes, if he takes sugars in high calories, then definitely he is going to develop diabetes in near future. So we cannot correlate directly it to the sugar level intake. It is the genes plus the sugar level.
This is a season of diarrhea, typhoid. You must be getting a lot of patients right now. So what kind of facilities do we have at Naveen Hospital to handle such kind of, especially children? They are very prone to these kind of problems. They eat outside, they go to school, they eat outside, they drink water from any tap or anywhere, and then they get diseases like jaundice, typhoid, diarrhea. So what kind of facilities do we have at Naveen Hospitals for them?
Basically these are waterborne diseases, mostly water and foodborne diseases. So these diseases normally flourish in the rainy season or summer season. Normally they do not occur in winter season because of the climatic condition. The bacteria and viruses, they grow more in these conditions. So people who eat outside or they drink contaminated water, they are prone for developing these diseases. So we have a good facility of treating all diarrheas, dysenteries, hepatitis, and these all communicable diseases at our hospital. We have isolation areas where we can treat them. We have a good hygienic
The
food
disease that
and
has
water.
come up means initially we used to know only malaria as a disease which was caused by mosquito. Now another disease is dengue, chikungunya, and all those things. So this is a very seasonal disease, of course. So are we prepared? Because it's very soon, after a few months, you will be having that season where people will be coming to hospital with dengue, with chikungunya, and all those. So are we prepared to take so many patients? Means the capacity we have, of course, we are a 100-bed hospital. They are, the beds are basically defined for other specialties as well. So how you take care of that kind of patient that come in such a huge number at that time?
Yes, that is a very relevant question. We had a surge of dengue 2 years back, and we had almost 50 to 60 patients at a time in Naveen Hospital. So as the time comes, normally the time is during the rainy season, that is July till December. So that is the main peak for dengue, and that is because of mosquito. It is a vector due to which this dengue appears. Then all know there are symptoms of high grade fever with headache, with body ache, with joint pains, and their platelets go down. We have good facility, we have ample number of beds to treat all the patients at a time, because we have treated, and there is beds are defined for other diseases, but as soon as there is a surge of patient for any other particular disease, we can switch over. We can get platelets and whole blood from Naveen Hospital Dadri, that is another center at Dadri, and we arrange platelets from other hospitals as well. We have tie-up with other Rotary Club Blood Bank and other blood banks at Ghaziabad, Delhi and Noida. So that is not a big issue. Normally platelets are only transfused when the patient is actively bleeding or the platelet count has gone down below 20,000. So normally not every patient of dengue require a blood transfusion or platelet transfusion. Very important aspect of our health is the preventive health. Actually there is a part of medicine, when the disease has occurred, then we treat the disease, but then there is a part which is preventive medicine or diagnosing the disease earlier. So for that thing we have designed a few health checkups to diagnose the disease before they appear. For example, the diabetes, hyperlipidemia, which leads to heart attacks later on in stage of life. So if we diagnose these diseases early, then we can very well prevent the heart attacks and for that matter strokes in the older age groups. So we have designed many health packages for early ages, like 40 age group. So we can diagnose these metabolic syndromes earlier and we can treat them accordingly.
Okay, it was extremely nice talking to you, Dr. Singhal, and we would appreciate whatever time you have given to us, and we expect that you take Naveen Hospitals to further heights. Thank you so much for your time.
Thank you.
Thank you.